Assisted suicide should be made illegal in the U.S. Every physician takes a Hippocratic oath, meaning it is their duty to follow it, not break it with reckless abandon. It isn't of a doctor's oath to purposely murder one of their patients. As it clearly states in the Hippocratic oath, I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect. It is a doctor's job to do their best to heal their patients. While we understand that some illnesses don't have a cure yet, how will doctors be able to find a cure for any of them if we kill the people who have it? It is a doctor's job to make you comfortable while you're in their care. Allowing physician-assisted suicide is allowing doctors to break away from their oath and kill their patients. The assisted suicide criteria isn't universally agreed upon in the medical field. According to New York Times, only 2 physicians have to approve the patient for the treatment. Also, they only use past information to determine the mental health of the patient. The decision doesn't have to be unanimous either. They could disagree and still do the treatment. Plus, half of the approved cases for physician-assisted suicide were patients that were just denied health care, and they could have been cured, and we chose to let them be killed. We allow the criteria for this treatment to lack an emotional connection to patients. These doctors look in the eyes of people and kill them mercifully. While we understand that having an emotional connection to patients can be hard, because if they die, you feel like it could have prevented their death. But yet this gives the doctors a reason to save them. As I've stated previously, half of these cases could have been prevented, but the physicians approved them without a second glance. For this treatment to even be a little acceptable, we need to have stricter criteria to make sure these people couldn't have had a future ahead of them. Having this treatment available to terminally ill patients is getting mixed emotions from around the globe, and we haven't really looked into what these doctors are doing. Doctors who complete the assisted suicide for the patient are basically committing murder, and we call it important and revolutionary. According to Dr. Neil Wegner, director of UCLA Health Ethics Center, the law has been made illegal in California and won't participate in the treatment. Wegner states, "We have always, up till now, been able to say that we will never hasten to death. Suddenly, that bright line isn't so bright anymore. A doctor's intention is to help their patients, not murder them. The idea of murdering their patients already makes doctors uncomfortable. As we have shown, the head doctor at UCLA Health Ethics Center has said he won't take part in this treatment. So I must ask you, if a head doctor with past experience of patients dying refuses to do the treatment, why would a less prepared doctor want to do this treatment, knowing that they are the ones who killed them? All families of a patient who is in the hospital with a serious illness or a minor surgery worries nonstop about losing someone they love. Having this available causes distress in the families of the patient, adding another level of worry. According to Consumer Reports, the families of someone who has passed away from a terminal illness without the assisted suicide treatment have felt more emotionally and mentally prepared for the death. Also, this leaves guilt, regret, anger, and grief on the family, ending the relationship. As I have stated previously, families felt more prepared for the death when the patient didn't do the assisted suicide treatment. My grandpa passed away 2 months ago, and this was very sudden, and for a few moments, you really didn't know what to do. I had to realize that he was going to die, but we had to make him comfortable. His medicine that made his body function the way it's supposed to stopped working. His face got very swollen, as did his arms. He couldn't eat or drink anything, and so he decided to be taken to the hospice and to be with his family and just to be happy. He had many instances before where he could have died, but he didn't, and he decided to keep fighting. This time, he decided there was no point, and he was done. We all accepted that. I admit, having my grandpa that raised me while my parents were at work for the first 5 years of my life is hard, but I know that I wouldn't have been okay with a doctor killing my grandpa, instead of him being with just everyone he loved and going without pain. Just think, if this was someone you loved, what would you want them to choose?